Hi Healthy Buddy, welcome to my channel where we will talk about various health matters. I'm Dr. Tirta Wijaya. Today we will talk about creatine. Please note that this is different from creatinine. Creatine is a chemical compound that comes from three amino acids, arginine, glycine, and methionine. It is found mostly in our body's muscle and about 5% in heart, brain, and other tissues. We can get creatine from the food we consume every day, but our liver, pancreas, and kidneys also can make about 1 to 2 grams of creatine per day. Creatine is stored as phosphocreatine primarily in our muscles. This is a form of stored energy in the cells that help our body to produce adenosine triphosphate or ATP faster. As we all know, adenosine triphosphate is the main energy currency in our body. During high energy activities, adenosine triphosphate is broken into adenosine diphosphate or ADP and a free phosphate to release energy. The suffix 3 means 3 and D means 2. This energy is used to power various functions in our body, including muscle contractions, chemical synthesis, intracellular signaling, neurotransmission, DNA-RNA synthesis, and many others. When there is a rapid drop in ATP and increase in ADP, phosphocreatine can quickly donate its phosphate to the adenosine diphosphate with the help of enzyme creatine kinase. So the adenosine diphosphate can be adenosine triphosphate again and ready to be used again. This process is very fast and important in activities that requires bursts of energies like sprinting, weightlifting, jumping, etc. After the high intensity activities are over, our body replenishes the phosphocreatine stores using energy from other systems. This restoration process needs oxygen, nutrition from food we consume, and time. Because the amount of phosphocreatine in our muscles is limited and the replenishment takes time, people take creatine supplement orally to increase their phosphocreatine so they can have more steady supply of energy in their muscles to keep working to improve athletic performance. People also use oral creatine to treat certain brain disorders, depression, neuromuscular conditions, congestive heart failure, and many other conditions. Topical creatine might be used to treat aging skin, but as per now, there is no good scientific evidence to support this yet. More studies need to be done on this. Research on creatine use for specific activities and conditions shows that oral creatine use might allow athletes to do more work in one session, leading to a better performance and greater gains in strength and muscle mass for high-intensity activities that require a rapid recovery during training and competitions. It is not clear if it helps with cardio exercises. And number 2, oral creatine might boost water content in muscle cells that help to increase muscle growth, reduce the frequency of dehydration, muscle cramping, and injuries to the muscles. 3. Creatine supplementation might help counteract age-related declines in skeletal muscle and bone mineral density. Early studies shows that men benefit more than women in this. And 4. In children with certain creatine deficiency syndromes, oral creatine supplements might improve some symptoms. Number 5. Creatine supplementation might improve performance during cognitive tasks, especially in older adults. Taking oral creatine supplement can also increase creatine levels in brain of people who are suffering from disorder of creatine metabolism, but not in children who have a creatine transport disorder. Who can use creatine? People who have low level of creatine, such as vegetarians, appear to benefit more from creatine supplements. Creatine might benefit athletes who need short burst of speed or increased muscle strength, such as sprinters, weightlifters. Athletes who do exercises that require longer periods like jogging, swimming, may not be benefited as much. While taking creatine might not help all athletes, evidence suggests that it generally won't hurt if it is taken as directed. The general recommendation for people who do take a creatine supplement is 3 to 5 grams per day. Loading up on a higher dose of creatine has no advantages. You are just giving extra workload to your kidneys. When used orally at appropriate doses, creatine is likely safe to take up to 5 years. As with any dietary supplements, it is important to choose a product that follows recommended manufacturing practices and subscribes to third-party testing to ensure the product's quality. Unlike over-the-counter and prescription drugs, the accuracy of supplement contents usually are not as regulated. So, there is always the potential that a creatine supplement contains less or more than the amount on the label. Also, the supplement may contain other ingredients that could potentially be harmful for you. I personally tend to err on the side of caution and prefer to supply my creatine needs from my daily diet by consuming creatine-rich foods like meat, fish, and seafoods. If you are not lactose intolerant like me, you can also consume animal milk as they are good source of creatine too. What are the side effects of creatine? Well, creatine can cause weight gain because of water retention and increased lean body mass. Number 2, excessive sweating or hyperhidrosis, then dizziness, nausea and vomiting, and diarrhea. Try to divide your creatine dosage to several smaller ones if you are suffering from any of these side effects, and consult your doctor if the problem persists. Creatine might be unsafe for people with pre-existing kidney problems. Although creatine might worsen kidney dysfunction in people with kidney disorders, creatine doesn't appear to affect kidney functions in healthy people. 2. Pregnant or breastfeeding mothers. There is not enough study on this population. And number 3, people diagnosed with bipolar disorder, as creatine might worsen the mania episodes. Number 4, people with Parkinson's disease. The interaction between creatine and caffeine more than 300 milligrams per day might worsen the progression of the disease. In people without the disease, combining caffeine with creatine might decrease the efficacy of creatine too. That is my sharing today about creatine. I hope the information can be a blessing and beneficial for you. If you like this kind of health information, please like this video and subscribe to this channel to continue getting doctor-approved medical information. If you have health-related topics or questions you want me to cover in the next videos, please type them in the comment section below. But please consult your doctor for specific health issues. This is my disclaimer. Thank you for watching and see you in the next videos. Stay healthy and happy.